Welcome back to Trinidad and Tobago. What are you seeing? Well, this is our Wellness Wednesday segment, and we're talking a little bit about, did you know June is International Acne Awareness Month? Well, that's a little bit of facts that you probably did not know. And now we're making you fully aware of the fact that when you think acne, most times people think childhood acne, they think teenage acne, they think hormones. Well, some people don't know that a lot of adults also are battling with acne. And I can tell you that I, probably up until a year ago, I would have sporadic breakouts out my skin, and it's not something that you would know how to deal with and understand how to deal with everything that comes with aging, the process, your skin, and even taking care of yourself. And when your skin doesn't look good, you don't really feel your best. Trust me, I know this. But joining us on the set, well, she has been described as the one who has revolutionized skincare in Trinidad and Tobago, Dr. Rachael Eckel. And also we have Dr. Manna joining us on set. She's now part of the Skin Health Institute. Good morning. Thank you for joining us.
Good morning, Hema. Thank you for having us.
Now, we're talking acne. When I think acne, I think someone who has really bad skin. I think all of the scars. When I say acne, what exactly does it refer to?
So acne has many different presentations. Remember that no disease just affects one cell at one spot in one layer. Disease such as acne affects all cells at all layers throughout the entire face. So it's not just blackheads or whiteheads. You see discoloration, which could be too much or too little color in the skin. You can see acne scarring, you can see large pores, rough texture, dullness, sensitivity, dryness. All of these can be manifestations that coexist with the acne. So it's important to recognize that there are many different presentations which can look different in you and look different in me because of our different ethnicities.
Do we normally, when I look at maybe some skin, my skin's not looking good, is it easy for me to misdiagnose myself and think, well, yeah, I have acne and just go and get an over-the-counter drug? Do people do that quite often?
Yes, and so one of the saddest things that I think I see in clinical practice is that acne is completely preventable. And the later, more advanced stages of acne, where you see things like acne scarring, which is permanent, this can all be prevented. And it can be prevented if you treat from the first sign of the pimple or the first comedone. Because what happens is that the acne will begin, and then later, the longer it's there for, is it will start an immune response in the body. So then the whole body will become involved in this condition, and the immune system will mount a war against the skin. And then that's when you see things like scarring. So instead of, going out and trying over-the-counter things and failing for many years, see a professional who deals with a disease, who understands how to treat skin, clear it in a New York minute, and then enjoy your beautiful skin.
When should I be worried? Do I get one pimple? If I see one pimple, should I think, okay, it's the end of the world and this is going to cause this massive breakout?
I think that scarring definitely means that you have advanced acne. Scarring is a sign of the systemic immune response. And a pimple will go, but a scar will stay. And a scar is a permanent defect. So we can never make a scar perfect. No matter what lasers we use, no matter what dermal fillers or what topicals, a scar is permanent. And so if you have a child or a teenager and they have acne and you're seeing scarring, you must do something about it in order to prevent those long-term changes.
Rachel, when I think acne, I normally think teenage acne. I think, it's something that happens when you're probably 13, 14. How common is acne?
So acne is actually the most common condition that we see and treat in our clinic. Teenagers are mostly the majority of patients who start presenting with acne, but not only do teenagers have acne, patients who are adults have acne as well, because there are so many different factors that have a role with respect to acne. Acne can be genetic, hormonal factors as well. So from the age of puberty, teenagers have a change in hormonal changes. They have increase in testosterone that causes the oil glands, the sebaceous glands to become very, very active and start to produce a lot of acne as well. But likewise as well with pre-menopausal patients, likewise with patients with PCOS, polycystic ovarian syndrome, or even simply just hormonal changes around menstruation as well. That can cause a surge in the oil glands and cause patients to have very oily skin and acne as well.
So I look at the fact that is everyone susceptible to acne? Or is it a particular skin type? Is
Interestingly,
it?
last night we were reading a study together about the statistics regarding acne, and this one study quoted that 100% of teenagers get acne.
From acne,
so
yes.
it is a normal teenage thing to have the odd pimple.
Right.
But usually what happens around the age of 18, when we exit puberty and the hormones subside, is that the acne will resolve. But more commonly in this environment, it's not resolving. Because remember that acne is basically, acne equals acute inflammation in the skin. It's a disease of inflammation. So if we continue to have inflammatory stressors on the skin beyond the age of 18, like the wrong diet, like heat, humidity, the wrong makeup, sun exposure, wrong skincare products, the acne is absolutely gonna continue into adulthood.
You know, the interesting thing with me is I didn't have acne growing up. I probably started getting acne breakouts when I was in my 20s, and it continued until I saw Rachael. But you know, it's interesting, the physiological and psychological impacts on a person. When you see or treat an acne patient, what are some of the things that they tell you?
Well, Dr. Manna actually had acne when she started working with us. She's been at the Skin Health Institute now for 3 months, and you've seen her incredible before and after images on the screen
she's
today.
one of the, and no one would believe that, and I think we have the images that will come up, and it's routinely coming up.
And that's just 3 months in. And her acne was cleared after about 4 weeks, and now we're just working to refine the skin, some of the large pores, the acne scarring.
Texture, yes.
But you can speak personally about that.
Okay, so there's that's one of your photos there.
So that is my incredible transformation, and that was actually in just like a month and a half alone, Hema. So really, really great results. Not just the acne has been cleared, but the areas of pigment as well, the areas of lightness and darkness, large pores, oily skin, everything has cleared away very, very nicely.
And look at the image. Look at something important here. Yes, the skin looks better in the before and after image, but look at the eyes. There's something greater here. You see a change in confidence. In the image on the left, you're looking away. In the image on the right, you're a little bit more upright, more confident, and so there's a huge change in personality and confidence that happens as you treat a patient's acne.
Do you see that quite often? Is that the normal story?
Absolutely. We have so many patients that will come to us, younger patients, even adults as well, and their face, they would be looking downwards. They wouldn't even be making any eye contact with us. They would be on their phones all the time as well.
When people think acne, I just think skin. I just think bad skin. Can acne affect anything else?
The mind. So it can affect the mind of the person with the acne, but it also can affect how others engage with you, okay? So there was an amazing study that was done in 2011. And what this study did was they took patients' skin, and one image, they gave the patient clear skin, and the other image, they gave the same patient acne. And they basically displayed these images to a group of observers, and they said to the observers, tell us what you think when you look at these images. Patients who had acne were deemed 49% more shy. They were deemed stressed out, lonely, boring.
No.
Introverted, yes. 16% more boring than somebody with clear skin. On the other hand, patients with clear skin were deemed 51% more intelligent, happy, trustworthy, healthy, and creative. So remember that this is a 2-million-year-old brain, and we look at skin and we look at patients' attributes in a nanosecond. In 5/1000ths of a second, we develop a first impression of a patient. Are they attractive? Are they healthy? That's evolutionary genetics. And so it's important that when we treat acne, we realize that not only does it make me feel better and me more confident, but others also have a more positive first impression of us.
In adult acne, is it more difficult for an adult patient to come to you to say that because I know even when I was in my 20s and I thought, why is this happening? And it didn't occur to me that this is acne. I would have one pimple and two, and I think it's probably when I was 26 that I said, I have adult acne. Is it more difficult for an adult to come to you, or people even recognizing that there is a concept of adult acne?
I think that's a great question, and it's not something that is addressed enough, because I feel that there is a lack of education with regards to adults, and adults think that pimples are normal during menstruation, and it's normal to have, discoloration. They think it's normal because it is very normal in this climate for adults to have acneic skin, because we have very, very high temperatures. We have lots of humidity. We eat the wrong foods. We have a lot of inflammation from our diet. And so all of that contributes to a society that has a large, very, very high rate of acne. And so it's important to realize that that is not healthy skin. Healthy skin is free from active disease. And acne is a disease, and it should not be on the skin because it causes difference and changes in the skin, as we discussed.
It's interesting that you mentioned that. Everyone thinks that if you drink a lot of water and you eat a lot of greens, you're good to go. I mean, you've heard that so many times. How important is diet, and is that enough?
Huge. So I would say that, okay, so let's cut to the facts. We know that acne is genetic. So we know that you're born with the gene or you're not. And we know that from identical twin studies, that one twin can have, both of the twins can have the gene for acne, but one twin will get acne and the other won't. So it's genetic, but something will switch on or off the genes. We know that diet has a huge role to play in switching on or off the genes. And specifically, dairy, sugar, and refined foods are the ones that cause inflammation in the skin and trigger acne. Get this, I love this story because when I tell patients about acne and diet and they say, I don't know about changing my diet, I tell them this beautiful landmark study that was done in a little island called Catava. Catava is kind of like Tobago. It's got about 30,000 inhabitants. And on Catava, there isn't one case of acne on the whole island. Not one.
What do they eat?
Exactly. So they have the acne gene, but it's switched off. So they basically eat no sugar, no dairy, no refined foods. So they're eating fish. They're a fishing society. They eat lots of vegetables. They eat lots of fruits. And if they're going to have a carbohydrate, it's not a pizza and it's not ice cream. Instead, it's something from the ground, from the earth. A ground provision, like your sweet potato, yams, eddos. So think Eckel food that the Rastafarians talk about. That's a food that we need to eat to have good skin.
My final question to you, can acne be cured? And the scarring, is it permanent? Either one of you can take it.
So we will always have that genetic component of acne. So no, acne can't be cured. But yes, there are certain things that we can do.
You just broke my heart, but okay, what can I do?
Lifestyle has a major role with respect to switching off that genetic component of acne, the proper diet, the proper topicals as well, prescription creams, to settle everything, to treat your skin and then just simply maintain your results. Simply just by using the right sunscreen every single day as well. Simply by using the right hair care products as well. You can keep your acne gene at bay to decrease the amount of oil that is being produced on your face.
So the closing comment, then you have the information and the website to get more. And it is Acne Awareness Month. And I can tell you that, full disclaimer, I am a patient of the clinic and I battled with adult acne. So I can tell you, I know what you're going through. Seek help if you do need it.